was really scary for me. And of course, I hated every bit of it. It had various pieces of information. For example, what kind of birth I want, who should cut the cord, what would happen after I give birth, what should happen to my placenta. Enjoyed, although I was not enjoying at that point in time, but it really helped me to have Arun during that intense moment with me by my side while I was giving birth to a child. Hi guys, welcome back to my channel. My name is Neha and you're watching Immi Australia. In today's video, I will be talking about the 5 key differences between giving birth in India versus giving birth in Australia. So without further ado, let's get started with today's video. Alright, let's start with the disclaimer first. Everything that I share in this video is my personal opinion. Yours may be different than mine, and I respect that, so you should respect my opinion too. With that disclaimer out of the way, let's actually talk about the first difference. So in Australia, when you find out that you are pregnant, you get a positive pregnancy test, a home pregnancy test. You don't usually go to a gynecologist straight away until and unless you have one. You would usually go to your GP or your family doctor first. So at 5 weeks in 2023, July 2023, when I found out that I was pregnant at 5 weeks, I called my GP and I said, hey, I got a positive pregnancy test. What is the next thing that I need to do? I had a phone consult. I could have taken a face-to-face, but I chose a phone consult to save some time. And the GP was like, congratulations, let's get some blood tests done. Once the reports are in, book in an appointment and see me. So that's what I did. Instead of going to a gynecologist or a specialist right away, I went to my GP who took care of me up until 16 weeks and also afterwards throughout my pregnancy. Now, the second key difference is that according to some available data, around 74% of women in Australia choose to give birth in a public or a government hospital rather than a private hospital. So even I chose to give birth in a public hospital in spite of having private health insurance, and I could have gone for a private health provider, a private hospital to give birth. I chose to give birth in a public hospital and the service provided was top-notch. I made a video talking about it briefly. I will link it up here so you can check that out. But as compared to India, wherein my sisters, I have 3 elder sisters, all 3 of them gave birth in private hospitals. Fewer people choose to give birth in government hospitals in India due to a variety of reasons. On the contrary, in Australia, most of the women give birth in public hospitals. Number 3 is really close to my heart. As I was progressing along my pregnancy, my healthcare providers, my midwives, my doctors asked me for a birth plan or a birth preference. So they did ask me to type it up or write it down and give it to them in writing. So when I went in labor, one of the key pieces of documents that I carried with me was my birth plan. It had various pieces of information. For example, what kind of birth I want, who should cut the cord, what would happen after I give birth, what should happen to my placenta, C-section, vaginal delivery, skin to skin, delayed cord clamping. If you are expecting a baby, I'm sure you know all of these terms. So I was given full autonomy over the kind of birth I really wanted, as compared to in India, where most of these decisions are taken care by your healthcare provider. So I could have even chose to give birth in my home. So I could have had a home birth as well. But of course, I did not go for that due to several reasons. But yes, I had full autonomy over what kind of birth I would want. Now, this is something I did not like, but this is something that happens in public hospitals in Australia. So immediately after I gave birth at late at night, so around 11:30 p.m., so around midnight. As soon as I was cleaned and shifted to my room, Arun, or my husband, was asked to leave. So I just gave birth, I had the baby, and no one could stay with me because the visiting hours were over. And when the visiting hours are over, you are in a shared room in a public hospital. You're not allowed to have visitors. It is for the safety and privacy of the other patient in the room. So I was in a shared room. There was another patient with me in the room as well. So for their privacy, and the same rule applies for them as well. For my privacy, no one is allowed outside of the visiting hours. So I think the visiting hours were like 8 to 8, so pretty much 12 hours during the day your visitors can stay with you. But just after you give birth, there's so many things happening with you. You would ideally want your partner, your mother-in-law, someone you love to be near you, but I had no one. So that period of time until Arun came back was really scary for me, and of course I hated every bit of it, but this is what it is. Now, I know some hospitals in India have started to do this as well, but in Australia, your partner or your support person, you can choose one person or two in some hospitals, can stay with you during your entire birth. So not your birth, your child's birth. So I had a vaginal delivery, and Arun was with me during my labor, during my birth, and after I gave birth. So he was in the labor and delivery room, my birthing suite. If you have a C-section, your support person, your partner, your mother-in-law, whoever you choose, can also accompany you in the operation theater. So that's really common in Australia. I know that in some hospitals in India, they have started to allow that as well, but that's like a general rule in Australia, and I really like it. I really enjoyed, although I was not enjoying at that point in time, but it really helped me to have Arun during that intense moment with me by my side while I was giving birth to our child. While making this video, I realized I think I have at least 5 more things that are different about giving birth in Australia versus giving birth in India. So I will make a part 2 without making this video too long. So make sure you subscribe to my videos, to my channel. Give this video a big fat thumbs up. Share it with your friends. Let me know your questions in the comment section, and I will see you in my next video. Subscribe for part 2. Bye.